Well, the question we got today is what's the story with B12 and pain? Commonly, people get supplementation, injections, or even IV infusions of B12 and other B vitamins. Does that make sense?
I've been a patient of Dr. Margolin's for a long time, and I'm really satisfied with Dr. Margolin. He's helped me out of a lot of pain that I used to have.
I've been coming here for about a year or so now. Doc Mongolian, he's awesome. I give him all the praise in the world.
Hey, I'm Chad, and I've been a patient here with Dr. Margoli for about a year. Treatment here is great. Definitely recommended.
Well, story B12 and pain has tens of years of history. B12 was diagnosed quite a while ago in the 20th century. However, there was a condition called pernicious anemia, a form of anemia caused by B12 deficiency. There were cases starting from 19th century, people who were strictly vegetarian or vegan at that time, no animal products, developed different symptoms, including anemia, including psychiatric symptoms, including skin lesions, and including variety of different conditions called the great imitator, possibly associated with pain and nerve damage. And therefore, it makes some sense to supplement with vitamin B group, B complex, and B12 for people with chronic pain, primarily if they are on vegan or vegetarian or heavily plant-based diet, or above age 50, because above age 50, the absorption of vitamin B12 is decreased, and it's hard to estimate. And by the way, some people even doubt the blood levels. It's possible to measure vitamin B12 in the blood, but it's not clear how accurate the levels are. And also because it's a great imitator. So subclinical deficiency can not be manifested by anemia, but maybe by some other symptoms. And also because a lot of people have neuropathy, nerve damage, either from diabetes, from other chronic diseases, right? Or some called idiopathic, we don't know why. And for a variety of different reasons, you can get obviously alcohol and toxins and chronic disease and cancer treatments, and many, many other causes can cause neuropathy, different types of neuropathy. And deficiency in B vitamins either makes the existing neuropathy worse or may cause neuropathy by themselves. In practice, it's hard to differentiate between different deficiencies, let's say B3. I mean, in severe cases, it's possible. That's what's in textbooks. But in real life, deficiency between different subgroups of vitamin B is harder to differentiate in modern world because they're not so severe. In addition, vitamins of group B are water soluble. There is a big difference. For example, vitamin D, which we discussed in details in the past, it's fat soluble vitamin. So therefore, if you take too much, it's potentially be toxic. It stays in your body, even though you need to really get to levels of 80 or so above 100. There are debate and take outrageous doses. Like there was one guy who took 50,000 units a day or something like that, which is not recommended. Like 10 times the recommended dose. Vitamin B12 was suggested as not having a ceiling, not having toxic dose, even though toxicity was described in a few cases because it's water soluble. Unless you have problems with your kidney, you just it's excreted in the urine. Therefore, taking significant doses was considered to be safe. Classically, if you get it by prescription, it's 1,000 micrograms a day, which is many times higher than what's supposed to be required. Why the dose is much higher? Because, as I said, in older people, absorption is deficient. In addition, the recommended dose most probably was calculated to prevent anemia and not to prevent chronic pain and other symptoms, and therefore most people need higher doses. In addition, there is a theory that B12 can negate something called homocysteine and possibly prevent or improve cardiovascular health. And for that, maybe you need higher doses. There is no there is some sense to take it. There is debate how much you should take. Generally, I would say that 2,500 micrograms to 5,000 micrograms a week or 1,000 a day is a reasonable dose. There are also free variation of vitamin B12 on the market. There is something called methylcobalamin, hydroxycobalamin, and cyanocobalamin. Out of the three, the last one, cyanocobalamin, is the most stable and the most well studied, and I think I would recommend this. There is a lot of different formulation. There is sublingual formulation. This is, for example, if you look here in the small print, it will tell you is cyanocobalamin. This is also sublingual formulation, but this is methylcobalamin. It will say it here. It doesn't mean it's bad, but it's less studied, less stable. And this is also methylcobalamin. This is higher dose, 10,000. So some people maybe take it a week, once in 2 weeks. You can get something called bioactive form, but there are no there are different formulation of B12, right? They have methyl, adeno, and hydroxy here. You can get B complex as drops. A B complex would include different vitamins B, B1, B3, B6, B9, B12, B5, and sometimes vitamin C together, and you can take it in addition. Again, the assumption is they're water soluble, and if you take too much within reason, they will be excreted. Of note, there was a study recently in Journal of Medical Management that meta-analysis of multiple studies showed that if levels of vitamin B12 are too high, it can be associated with actually increased mortality, but people doubt it. They're checking the study. Maybe actually the increased vitamin B12 was caused by liver damage or people who had damage from other causes. So I just have to mention it. Having said that, most people consider it safe. It helps to some extent. I haven't seen a drastic pain relief with the use of this supplement. Many times people do mention higher energy because subclinical vitamin B12 deficiency is associated with lack of energy. So there is really no downside if you do it within reason. Thank you for this question.